Are you aware of the term VRIII? If not, we'll go through it together to help you get the confidence whilst prescribing IV insulin. As the name suggests, VRIII stands for variable rate intravenous insulin infusion. The old name for this was sliding scale insulin. It's fairly self-explanatory that variable rate intravenous insulin infusion means you give IV insulin, which will be varying according to the glucose levels. As you see, the glucose can fluctuate when you give IV insulin, hence there is a need to regularly monitor the glucose, and ideally this should be monitored every hour with a finger prick test. The insulin infusion rate can be adjusted according to the glucose levels to maintain tight glycemic targets in the range of 6 to 10 if someone is in ITU, or in the ward-based setting it could be a bit more relaxed in the target range of 4 to 12 millimoles per liter. Now this is not the ideal treatment for everyone, and we will be using VRIII in certain special circumstances. The idea is to maintain tight glycemic control when people are not eating and drinking. This could be either due to vomiting, nil by mouth, or they are just too unwell to eat and drink normally. If that's the case and their glucose levels are high, or they have diabetes, you maintain the tight, regular glycemic control with VRIII. There are special circumstances when acute hyperglycemia needs rapid correction, even if the patients are eating and drinking. For example, acute coronary syndromes, pregnancy, or use of high-dose steroids. If there is a need to prescribe VRIII, please contact the diabetes team, especially when the people are eating and drinking. Now, giving the VRIII means you give IV insulin and you monitor the glucose. The idea is to stop it as soon as the target glucose is achieved and the patient is eating and drinking. Plus, the usual medication for diabetes has been prescribed if someone is already known to have it. Majority of circumstances of VRIII prescription involve diabetes patients who may already be on insulin. So do not forget what type of insulin were they on when you are prescribing VRIII. VRIII is constituted by using rapid-acting insulin called Actropid, which is given IV and helps control the glucose quite rapidly. If anyone is already on subcutaneous fast-acting insulin or rapid-acting insulin, for example NovoRapid, Actropid, Fiasp, or any of the mixed insulins which may have a component of fast-acting insulin like Humulin M3, Novomix 30, then they should not be given subcutaneously along with variable rate intravenous insulin infusion to avoid unpredictable effects. However, the long-acting insulin, which doesn't drop the glucose rapidly, should always be given along with the VRIII. Long-acting insulins could be Lantus, Abazaglar, Toujeo, or a variety of other newer ones. If you're not certain, just ask the diabetes team or someone who is more senior than you, or simply check in the BNF about the type of insulin. The idea is to carry on the long-acting insulin. Remember, when variable rate intravenous insulin infusion is being given, the glucose can drop down. So do not forget that you will need to give IV dextrose or glucose alongside the variable rate IV insulin to prevent people from having hypos. Now, this is called the substrate fluid. It can be any fluid that contains enough glucose to maintain blood glucose levels within target range whilst the insulin is going IV. The Joint British Diabetes Society advocates prescribing mixture of half-strength saline and potassium chloride along with 5% dextrose. This is prescribed as 0.45% sodium chloride plus 5% glucose plus 0.3% potassium chloride as an infusion. This can run as 125 ml per hour. An alternative to this fluid would be 5% dextrose with 40 millimole potassium chloride to be run as 125 ml per hour alongside the variable rate intravenous insulin infusion. There would be individual scenarios when patients would have special fluid requirements requiring review of their fluid status as well as electrolyte disturbances. In all those scenarios, please consult the relevant specialty teams to make appropriate choice of substrate fluid to be used with variable rate. You must know when to stop VRIII. If you're not sure, ask someone who is more senior than you, or just consult the diabetes team. The key objective to achieve before stopping variable rate intravenous insulin infusion is to ensure that the target glucose has not just been achieved, but it has been maintained for a few hours. The second most important thing is to make sure that your patient is able to eat and drink normally and wait for a meal time. Ideally, this should be breakfast or lunch time. However, VRIII can be stopped at evening meal time as well, as long as you're happy with the eating habits of your patient and you make sure the patient is not nauseated and is not feeling sick. However, avoid stopping variable rate intravenous insulin infusion at night or at bedtime. Avoid stopping variable rate intravenous insulin infusion at bedtime or overnight to prevent further relapse of hyperglycemia and subsequent complications. When your clinical judgment suggests that the variable rate intravenous insulin infusion can be stopped and your patient is ready, you wait for a meal time. Give them their normal rapid-acting insulin. This could be isolated rapid-acting insulin or a mixed insulin, and wait 60 minutes whilst continuing the variable rate and then stop it. This ensures that the subcutaneous insulin has been absorbed into their system and becomes available once the variable rate has been stopped. This covers majority of scenarios related to variable rate intravenous insulin infusion. However, it still doesn't cover all the individual scenarios, so there would be circumstances when you're still having some questions related to VRIII. So never forget that your diabetes team is there for you, always happy to help. So do not hesitate to contact us whenever you need to.